what we're really talking about today is full arch dentistry. All on X is kind of the hot topic, the hot name. Really, all on 4 started, and now it's just kind of all on X. I mean, just everything on implants. So that's kind of the nuts and bolts of what we want to build around today is, hey, how do we do a full arch case that's supported by implants predictably? How does, somebody that, isn't an oral surgeon, or doesn't have, years of implant training or, tons of cases under their belt, how do they jump into this stuff? So I'm going to kind of break it down and say, hey, these are the kind of cases you should jump into. How can you do it predictably? How should a beginner start and still provide a higher level of care than they're going to get elsewhere? I think about, most full arch dentistry, most implants that are placed in, surgical centers, oral surgeons' offices, it's not guided. I mean, it's freehand, right? And so, years of experience can really, really help with that. But, I think that there's certain applications to technology that really just bring that, that general dentist or that beginner up to that higher level in case planning. Because it's like, we talk about this a lot, it's not about, patients don't want implants, they want teeth. And those teeth are what drive the case. Where the teeth are gonna be, that's what the patient wants at the end of the day. They don't want screws, they want teeth. So we've got to put those implants where they need to be to support the teeth. So, we talked about this before, but it's all about the wax up. It's all about the where do we want the teeth, and then we build the case to fit in that mold. The best surgeons that I've seen, they'll have, best case scenarios, they'll have a duplicate denture with just a big lingual window behind the teeth, so for an upper. And they'll sit that in there and they go, okay, as long as I'm in this giant window, anywhere lingual to the teeth, I know my restorative dentist can restore the case without a screw hole access coming out the facial. And that's really the best that's being done. So we want to take that mindset, but take it way further and actually predict, okay, on that final prosthetic, where is my screw hole going to be within each tooth? Because it's going to give you the thinnest, strongest, most predictable final restoration. That's what the patients want. So I like this picture. This is a cool, example of a surgical guide. Kind of shows you various aspects, pins and tubes and metal sleeves and palatal support, complex guide that was designed. We're going to focus on really hey, what's a predictable full arch guide that we can start doing Monday when we get back to our practice. I think that's super important, is keeping this simple, because you can get really, really complex with guides. But we found a way to really simplify it to be fast, efficient, and easy to understand for anybody that's kind of new.